It's my internet. What's the problem? I did already, but I don't know. It's not connecting. Can you hear me?
Yes, I can.
Hello?
I can hear you. I can hear you. What happened to my teacher? My teacher ran away. Should have just left it though.
There's something wrong with the internet today
Oh,
because it went off. That's why I could not hear the recording. I pressed it, but so just hold on. Can you see the screen?
yes, I can.
Okay, so let's proceed. I don't know. Let's proceed. So we have to look into the monitoring and evaluation, the MU of changes that occurs within the health and social care sector. The MU shows whether a service program is accompanying its goals or accomplishing its goals. It identifies program weaknesses and strengths and areas of program that needs revision and areas of program that meets or exceed expectation. And to be able to do this, we need to look into any forms of program domains that is required. While the MU also looks into essential management tool, which help to ensure that health activities are implemented as planned and assess whether desired results are being achieved. Monitoring, therefore, would have to look into provide current feedbacks, as we usually do, to identify problems in their implementation and to take corrective action to sort of correct those problems that have been identified. Then we have to look at evaluation to reassess whether the desired results of the program have been achieved, and if not, how those can be redesigned. So eventually we saying that there should be a check and balances or a monitoring and evaluation tool or process that should be made available within our organization, most especially within the healthcare sector, to be able to sort of identify or determine when there are problems and when these problems have to be dealt with. So the ME is a tool that you would have to put in place to sort of mitigate or correct those errors that happen in the organization. One of these in a care home could be questionnaires, could be questionnaires that you give out to um, service users and families to sort of give their feedback to you, and that would help to be your sort of evaluation and monitoring that you can use to gather information. Some care homes we have cameras as well. You know, they have IT system that monitors what happens. So these are all monitoring and evaluation tool that you can use. But you also have to look at strategies that can be used in the monitoring process as well. Strategies improve the feedback via surveys and interviews. I've just said this. Feedback, surveys, and interviews are a form of monitoring process that we can use. Carrying out a self-evaluation analysis to see how the changes have impacted on your practice could also be 1 minute, please. 1 minute. Then carrying out a self-evaluation analysis, which is key. Self-evaluation of staffs to see how the changes have impacted on your practice. And then SWOT analysis. You know much about it already, isn't it?
Yeah.
So
Strength, weakness, opportunities, and threats.
exactly, yeah.
It's
So
about the people that you want to use to accomplish the task.
good, good. But what function would SWOT analysis be positioned? Is it internally or externally?
It's internally.
Perfect. So SWOT analysis are more used to sort of have your evaluations within your internal organization, not external. So it better informs you how to where you are lacking. You know, to identify where areas that need improvement per your weaknesses, areas which are your strength, then you need to maximize that, and the opportunities that may be available that you can tap into internally. It could be government funding, it could be staff trainings that you don't have to pay nothing, and all that. And then the various threats. But the threats is it has the resemblance of both internal and externally. When it comes to threats, it is not only the threats within, but also the threats that externally that you face as a company, and then you have to put in the shock absorbers internally to deal with the stress outside. You understand?
Yeah.
So that the only part of it, the threats are more the external threats that a company makes. It could be competition wise. It could be the product you are selling. Others are selling the same product, so they become threats to you. To country wise, it could be political threats. You know, it could be geopolitical threats, social political threats. So for bigger organizations, it may be that. However, for private companies, it is more to do with the threats that you feel as a business or in terms of competition. So you can have competitive advantage over your other competitors. So those are the things you have to look into. And there's another tool that we call PESTEL. It's not in the handout, but you can learn. It's called PESTLE, PSTLE. We use that to it's a tool that we or analysis that we use that in determining external issues, political, economic, social threats, and all that. It's called PESTEL. Okay. Okay. Then we have to look at the various benchmarkings or strategies, still on the strategy. So we can use the benchmark carrying out evaluation of changes against the set of standards. So every organization have a set of standards. And you have to look at benchmarking, having to assess and ensure that the standard that you have set up could be a quarterly standard or a yearly standard. Those set standards are being met. So there should be something that you use to check that we call you have to benchmark them. There are things that you have to check, ensure that quarterly you want to use a target of 20,000. How do you determine what are the things that you're going to put in place, the benchmarks to mark if you are achieving that way, or how you can achieve that 20,000, let's say, turnover, you know, the quality measurement. You know, in healthcare quality, it is a level of value provided by any healthcare resource as determined by some measurement. As with quality in other fields, it is an assessment of whether something is good enough and whether it is suitable for its purpose. So basically, that's what it is. You know, quality in other fields, assessment of whether something is good. So quality, have you heard of the ISO 900, 9000? Yeah, so it's a quality system that companies put in place. So it helps against your processes and your quality measure. It's called ISO 9000. What deal is quality? It's a system that ensures that quality of organizations are met. And when you have them, when you have socially passed and you implement that, when anybody wants to use you for business, when they see that, they realize that your company is clearly certified. You understand?
Yeah.
For ISO 9000, you can Google it and see ISO 9000. There are so many of the international standard organization. I've not heard the name before.
Yeah. Wow.
Yes, so they deal with quality and standards worldwide, compliances, and the system developed with their own organization. You can also develop your own system to measure or to monitor shortfalls and quality, and that quality malfunction that does not going well in organizations. You can have your own software to determine that as well. And data and performance indicators. It's a summary measure aiming to describe a few numbers in detail to enable prediction, comparison, or improvement. So you can have your data and performance indicators as well. It could be a pie chart or an histogram that you would always have to take whenever you are, your target is being met. So you can see your performance indicators, what you achieved 2017, what you achieved 2018. So you will know that whether there's a decline or there's a rise. You understand?
Mm-hmm.
Yes. So by drawing that and checking, you will know 2017, 2000 turnover, and then 2018, 1000. Then you realize that there's a decline. So that will help you to say, oh, is there what is wrong? Why are we declining in terms of our numbers? Why are the staffs resigning every now and then? You understand?
Mm.
So these are the things you say, okay, this year or this month, 2 staff resign. 3 months ago, 3 staff resign. So what are the problems? So there should be a problem within the organization that needs to be dealt with. It could be a staff issue, it could be the management, it could be the manager in charge of clinical services. Maybe it's too rude, it's not too, and people are resigning. So these are all things that you can use to check your performance indicators and your data as well. Okay.
Yeah.
Any question, please?
I understand.
Sure.
Yes, that we need to monitor. If you have changes, the changes must be monitored in order to achieve the required result. And you need to evaluate the system you use to check to monitor these changes that are happening within your organization.
Uh-huh. So you're okay with that, right?
Yes.
Okay. So 1 minute. Then we have to look into monitoring. We've spoken about monitoring already. We've spoken about sorry, this has gone too far. We've spoken about why we have to monitor and a diagnosis of causes of deviation that are carried out and suitable corrective measures. And so in monitoring, we have quality control, quality assurance, and quality, so quality control is more to do with monitoring. What we seek to do as service providers or even what companies do is that they try to look at the corrective measures in correcting stuff before it gets damaged. So you have to have the monitoring processes in place, or what you call quality control. You control the entire supply chain, the entire process from management to the damp person. So you have to put in methodologies that would help you to monitor these processes so that you can every now and then identify within the supply chain problems that are not right, rather than waiting for it to be corrected at the end product. Okay.
Yes.
So in so doing, it helps to set norms of performance. It helps in measuring level of performance. It helps in comparing performance level with standard or norms. And it helps in identify deviations and explain the reasons for deviation for taking necessary corrective action. So what may be then the different levels of monitoring? We have the managers at top level. So obviously every company would have its top tier management level. And they have to develop health plans based on objectives, always goals, devise strategy, and allocate necessary. So they are what we call the strategic planners. They strategize for the organization and ensure that the set of objectives, the visions, and the missions are met. Then we have the middle class people that may be the managers or middle level, or some may say senior management, or we have junior management, isn't it?
Yes.
So the management level, they are more concerned with whether they are getting desired output from the input that has been utilized. So they are more to do with the junior rank department. So whereas the top one, they are more bigger, the managers seem to be maybe head of department, head of clinical department, head of food and nutrition, head of safety. Those are the ones we're talking about. Then we have the managers at operational level. They are there to supervise actual operations and to ensure that planned activities are being carried out as per schedule. So you may have operational managers as well. Yes, every may. So those operational managers seek to ensure that on the field, the job on the field are done as expected. So we have to also look into the number of criteria to see what affect these changes and how they have been made on health and social care sector. So some criteria that we can use to measure this impact include the benefits to service user, better appointment, and faster services. We had discussions on this before. It could be technology that is being improved to deal with some of these things, and efficiencies, administrative times, discharge of patients, easier to access data, proficient working times, and additional staff. So these are all criteria that we can use to ensure a patient to save service user or a better informed or a better enhanced efficiency to help in discharge of patients, data, and working times. All right.
Yeah.
Then we have to look into how we can measure the impact of recent changes on health and social care against this set of criteria. Increased quality of service. A better quality of service is being delivered due to recent changes. Of course, when this are done, the market share, hospital market share is measured by the breadth of service offered, distance to customers, public perception, and physician capacity. So distance to customers. Where are they? Where is the hospital located? Is it accessible by service users, or they have to travel very far? So all these are things that we have to look in. The public perception of the hospital, or what the physician capacity. Are they enough physicians within the hospital? So these are all things that informs the changes that occur in our organization. Then accessibility, we all know that changes that reflect how services users can access services, when your services are available from online to telephone appointments, mobile clinics, and care. So all things, so how are we able to devise a way that things become easier people to access information? These days, doctors will call you on phone and they'll talk to you without you not coming there after hours. You can go to some GPs or some clinics in the evening for your own appointments and all that. So these are all interventions that helps within the changes of healthcare. Then we have to look at evaluation, where evaluation is a process that critically examines a program. It involves collecting and analyzing information about programs, activities, characteristics, and outcomes. Its purpose is to make judgment about a program, to improve its effectiveness, and or inform programming decision. Pattern 1987, that's references. So what would be the reasons for carrying? Yeah. So what do you think, your own opinion, be a reasons why evaluation will be done in an organization or even your own family? What do you think?
To better improve service, the current service, to probably improve time management, and to give better access to a wider range of people.
Mhm.
Um, yeah,
That would be so. I mean, yeah. So to access program towards desired health. I mean, we do evaluation basically because we have a target. Okay,
yeah.
we have a target, and we want to see if you are meeting the targets. All right.
Okay,
So
you mean I don't. You
the
said
reasons why we
why
do
we want to
evaluation.
evaluate
Exactly.
the changes.
Yeah. No, reasons why we do evaluations in general.
Okay, evaluations in general. Okay,
You
yeah.
understand me?
To see if you are meeting your target. Yes, that's true.
If you are a lady and when you were growing up, you said, "Oh, by the age 30 years, I want to get married. Okay. And you hit the 30 years or you are getting closer, you're not married. Don't you do evaluation?
Yeah, you do evaluation.
Exactly. 1 minute, please. I said that. Can you hear me?
Yes, I can.
Sorry. So obviously, 30 years you are not married. You will do evaluation, isn't it?
Yeah.
Because you had a target that through hook and crook, I want to marry by the age 30 years. So that is, and you will not be able to, you are getting closer to 30 or you're almost 30. So you do the evaluation and see what is the problem, isn't it? What is it? Is
Mm-hmm.
it a problem coming from me? Is it spiritual problem? Is it physical problem? You have a character problem, isn't it?
Mm.
Why all the men coming and why are they leaving? So we have to do all these valuations, okay? It's the same with businesses as well, isn't it? Every
Mm-hmm.
business will have a target, you know, profit targets, staff capacity, infrastructure capacity. If you supported living, maybe you want to have 5 supported living facility in the next 2 years. So you have to look into. So evaluation helps us to contribute towards better health planning related to the healthcare. It helps to document results achieved by a project funder. Because healthcare, especially at the hospital, they get funding from government. Okay. So if
Mm.
the donor gives you funding, you need to ensure that the funding has its own also restrictions and requirements. You understand? You have to meet
Mm-hmm.
the funding that's been given, the donor funding. Even countries, Nigeria and Ghana, when we get funding from United Nations and US, and they have restrictions, don't they? They expect you to comply with the funding restrictions. Okay,
Mm-hmm.
exactly. So these are the things why we do evaluation and we are related to healthcare. Also, to know whether desired health outcomes are being achieved and identify remedial measures to improve health programs and health infrastructure, to allocate of resources in current and future programs, to render health activities more relevant, more efficient, and more efficient. Okay?
Mm.
Yeah, so these are critical reasons why you would want to have evaluations as a person or as a business or as a care agency. But we'd also have to look into the service users and their families. What will be the measurement and evaluation impact on the overall changes within the health and social care? So let's look at a bit more here within the service users and their families. Are they able to get a better access to health facility? Yes or no? Have Are they care improved? Has the service users care improved? Do they have a say in their care? You understand? So these are what we call valuations, isn't it?
Yeah.
Service users can now become more involved in their care, from carrying out a need assessment to be able to sit in and participate in an annual review, stating if they can keep up with treatment costs and having it adapted in. In the management, there's something we call cost to benefit analysis. Sometimes we do what we call cost benefit analysis. We see that ensure that um, the money that we are having from families or from the government for a service user is enough in terms of the service delivery you are giving a patient. So probably you may have, please 1 minute, you may have a patient that at the time that they came to you, um, the budget. Oh, don't worry, don't. 1 minute. Don't ask me 1 minute. Yeah. They said that. Sorry, can you hear me?
Yes, I can.
Yes. You may have a patient or a service user who, at the time, probably when was admitted into your care home or your supported living facility, they may not have a complex care. You understand?
Mm.
So they may have probably one or two um, issues or disability. but as time goes on, their state of health deteriorated. You understand? And therefore, it requires a bit more um, support workers, or a bit more clinical. And so you realize that the budget for the person may increase, isn't it?
Yes.
Because the state of health has increased because he has a complex care, and therefore you need 24 hours care. And so these are things that you have to evaluate to for each patient. How is their state of health? Is it declined or has it increased? Do we need more staffs or we need less staffs? So these are all things that you have. You call it cost benefit analysis, okay? Cost benefit analysis. So another form of evaluation too that we use to check and ensure that the kind of costs that we incur, is it reflective? Is it in tangent with the kind of money we are getting? Okay.
Yeah.
Awesome. Then we have a service provision. A goal of health services provision is to improve health outcomes in the population and to respond to people's expectations while reducing inequalities in both health and responsive. Very key. The healthcare needs of the population should be met with best possible quantity and quality of services reduced at a minimum cost. Then we have staff providing the services in healthcare. The staff themselves, you have to evaluate the level of staffing. Have changes being made to reflect the staffing issues. You may have staffing issues, definitely. You may lack night staff. Probably you don't have a lot of people who want to do night, or you may have a lot of people who want to do day. So you have to look into increase your night staff. So these are all things that you have to look as a manager. For example, a center adapting for a 24-hour stay to a maximum of 12-hour stay to accommodate the needs for beds, higher turnaround of beds, and also to reflect the staffing levels. So this is a classic example. A center adapting from 24-hour stay to a maximum of 12-hour stay to accommodate the needs for beds. So you realize that per evaluation, a 24-hour stay is not really helping because you don't have a lot of beds, isn't it? So you have to reduce to 12 hours so that you can have enough beds, because at every time 24 hours, the beds are full, and therefore you don't have a lot of beds. Probably you don't have a lot of infrastructure or the capacity to even admit a lot more patients. So these are all reviews or evaluations that as a manager you need to take into consideration. And then also appropriate service responses. The service responses as well can propose changes to service user during different medium of communication. Changes such as the way in which a service user would contact health and social care services have been brought about along with the way in which health and social care services communicate information verbally, written or electronically. So these are all key things that we need to look into. Then it can also be linked to the outcomes of the measurement and evaluation, such as addressing staffing levels and lack in certain service provisions. Let's proceed. Clearly communicate need for change staff and senior management in order to initiate effective change. There may need to be a change in how services are managed. An effective way to do this is to ensure that the correct hierarchy of staff is in place. Staff members with the appropriate training and experience, very key. Very key. So you don't put in somebody who has a level 5 qualification below somebody who has a level 3. For this procedure. You understand me? You don't do that. Yeah. You don't want me to follow. Procedure.
Sir?
Yeah. So what was I saying? You remember?
You said we don't put someone with a higher
I said
qualification below.
it's not the best of practice that
Yeah. That you
someone
need
who
to
have
put the
done
hierarchy appropriately
exactly.
so that you can
So,
get
so
efficient
exactly.
results.
So you can imagine a colleague who has done a level 5 qualification and also have got the necessary training and experience. How would you put him under somebody who is a level 3 holder? Do you understand me?
Yeah.
So the hierarchies should be safe. You understand?
Yeah.
It should be well positioned. It should reflect staff level of qualification and their experiences. It is out of place. You cannot do that. It is not a, a, a proper administrative practices. It is not. Okay. And we have to ensure that they have the requisite experiences as well. And then so you may have, for example, you may have the national, the cohort, and local, the hierarchies, the one you may say designing new care models and enabling spread. Two, you have to evaluate and metrics. And then three, integrate commission and provision. Well, you're talking about the CCGs. And then four, empowering patients and communities. Five, harnessing technology. Six, workforce design. Seven, local leadership and delivery. Eight, communication engagement. Communication engagement is very, very key. It's very, very key. Then you have to look into what we call designing new care models. An example is vanguards will be supported to design and implement their overarching care model based on population needs and to understand the key components of their care model, which have the greatest impact and value for patients. So the key elements of support, local and care model design. That seeks to look at the analysis and supports segmenting populations, identifying intervention, access to NHS England's right to care program. Very key. And we have to look at the ongoing development, action to research to evaluate the impact of new care model components, clinical expertise and advice from new care models, clinical associates, and NHS England's medical directorate clinicians. So these are all things that you can read about. So let me, it's all there. You can read from models. You can see the quality payments, the bundle contract, integrated commission, procurement, very key. Procurement plays a very critical role when it comes to the NHS, okay?
Yeah.
Very, very important. You have to do open tendering. Contracts should be open to everyone, and those who qualify could be on the NHS framework. And the NHS framework involves contractors and subcontractors who have what it takes to meet up with the government policies. Again, finance plays a major role when it comes to the NHS framework. Are you able to have the finances to deliver a business or a domiciliary care job that requires about 50,000 or 70,000 turnover? So these are all things that we have to look into. You understand? So, and then we would have to look into the local workforce strategy, self-assessment too on capacity and capability for workforce redesign, support to develop plans for delivering local strategies. Two, common skill disruptors and job description developed for new and external roles, support to develop specific roles, training sources. Three, new ways of working, resources to support multidisciplinary working, mental health crisis care, transformation, person-centered community care, facilitated simulation exercise to understand the challenges of multi-professional working and peer learning sets. Very, very key. These are new ways of working. So you have to adapt. So you see the resource to support multidisciplinary working group. When you say multidisciplinary working group, for instance, on the local level, so let's say the Manchester City Council, whenever there's a safeguarding concern raised by a care home, a school against any person, there's always what we call the multidisciplinary working group. Okay. So
Yeah.
the council will have a social worker to represent them. The GAM, they will also have a rep for the police. Okay. And then if it's a school, you have their safeguarding officer. So it's called the multidisciplinary working group. what they do is to come together to help against anything that frowns against abuse and neglect. Okay, and safeguarding. Yes, person-centered care, very, very key. So if you're a parent and your child reports in your school that you have been beating him or her, you know what it means. It's a safeguarding issue, isn't it?
Yes.
There's every school have a safeguarding officer. So once your child reports that they'll investigate any, there's a merit, the safeguarding officer in the school would have to communicate that to the social service. Okay, social service will have a social worker. The social worker will also investigate, and when there's a merit in the case, they will have to call for a multidisciplinary working group that consists of the police and the social worker, and then that of the school rep social officer, and they will look into the case. Okay. And when they look into the entire case and there's a huge evidence against you as a parent, the social service have the right by law to pick up your children from you. Have you heard of such situations before?
Yes.
Yes, your children can be taken from you. Okay. Exactly. So these are and communication strategies and all that. No, there should be regular communication engagement strategy to help, and this all form part of the multidisciplinary organization. Sharing best practices and methods, tools that you help to share learning, part of detailed collaboration plan, online tool to enable rapid dissemination. And learning across the vanguards. So these are key things that we have to look into. Yes, just 1 minute. Then 1 minute. So, Pesedia.
Yes.
Sorry. And then let me talk about what about system leadership, community of practice, leadership programs, learning on system leadership from international partners. Okay. So we can learn from the international partners. Then we have some international integrated and flexible leadership programs to support specific needs, learning community for primary care, community professionals, and multidisciplinary learning sets. I've explained that to you already, haven't I?
Yes.
Yeah, and leadership at all levels. Exploration of ways to assess leadership schemes for clinical and non-clinical staff. Of course, every care home has a clinical and non-clinical, so in the hospital as well.
Yeah.
So these are the various things that I can touch base with you this area. So we've looked into today's strategies and criteria for measuring recent changes in health and social care, measuring the impact of recent changes on health and social care services against said criteria, evaluating the overall impact of recent changes in health and social care, and proposing appropriate service responses to recent changes in health and social care services. Your child is crying, right?
No, it's not mine.
Okay. Oh, are you at work?
No. It's just someone visiting me.
Okay. So the references, you have all these references to refer to. Okay.
Yeah.
You can find it in your model as well. All right.
Thank you.
Any question, my sister?
It's fine. I'm going to read about it again and come back to you if I
All
don't
right.
understand
Any
anything.
questions at all, let me know. Okay.
Okay.
All right. Best of day then. All right. See you next week.
Yeah. Bye.
Bye.